Hey everyone, welcome to the front row. Today we're going to talk about chronic neck pain and tightness. A typical neck patient that comes in to see me often complains about how they can get treatment, get massage, get acupuncture, fill in the blank, and they feel great for about a day or two, and then the pain starts to come back. So what they don't realize is they could be doing something probably right this minute as you're watching this video that could be contributing to that chronic neck and shoulder pain. And it is your breathing. Yes, your breathing, something that we don't even think about, okay? But it can be contributing significantly to, first of all, increased stress response, increased muscle tension and tightness. Now, there's all sorts of stuff that can happen when we're not breathing properly. So let's do a quick review of how we were designed to breathe and how typically a lot of us end up breathing, okay? Our primary breathing muscle is our respiratory diaphragm, okay? So without getting too much into the anatomy and physiology, it's basically belly breathing, okay? And it's a dome-shaped muscle that attaches onto the lower 6 ribs on the undersurface. On the left side comes down and attaches onto the lateral part of L1 and L2, and on the right side it comes down L1, L2, and L3. So what happens is it's kind of domed up in there underneath the rib cage. And so when I breathe into my belly and I contract that diaphragm, it pushes down, my belly comes out, pushes the abdominal content out, and then when I exhale, retracts, okay? So typically, think about babies when they belly breathe, right? They're nice and relaxed, someone's in a deep sleep, they breathe in and out of their belly. And that's how we were designed to breathe. However, most of us end up breathing in and out of our chest. Now our chest is designed to help us. They're only accessory breathers, okay? We have a muscle that comes right down to here. That's this guy right there. So if that's tied on you, okay, you're probably a chest breather, okay? It's called the SCM. Comes down from here, watch out here, comes down and attaches right up through here. And we also have the scalenes. Scalenes are these guys off this side right here. So if you have tightness up and through here, they come down and attach onto the first 2 ribs as well also, okay? I just ran a mile. I'm supposed to use these guys here as my accessory breathers. So this is my primary, this is my accessory breathers, okay? What's really important to remember is that most of us use a combination of both, diaphragm and a little bit of our accessory breathers. But when we're just resting, quiet breathing, we should be breathing in and out of our belly, and I'll talk about an exercise that we can do to kind of test it and to see where you're at. One more thing about breathing. When we are breathing in and out of our belly, we are dampening the sympathetic tone or the fight or flight response, okay? All of us have stress, right? Every single day we've got stress. I got 2 teenagers, I define stress. So what happens is when we breathe in and out of our chest, we are biasing our nervous system into the sympathetic tone. So we're telling ourselves, look, don't ever quite settle down because there could be a tiger around every corner. Okay? The body was not designed to be in sympathetic tone for long periods of time. So after a while, overall body just does not function well. So I always recommend people to breathe in and out of their belly at least once a day, and we'll talk about how we can test this, okay? So the first thing you want to do is go ahead and lie down, like our volunteer model is, with a book on your belly and a little pillow underneath your knees. And if you are breathing like this poor guy, you are in trouble. Because what he's doing is, with his quiet respirations, he is using his chest muscles. Okay, so he's chronically firing up those little muscles of the neck and shoulders to elevate the rib cage and breathe. So this is exactly how you are not supposed to breathe, okay? So, how does it look like you're supposed to breathe? There you go. He just switched. So now what he's doing is breathing in and out of his belly. And the idea is you want that book to rise as far as it can up towards that ceiling without your chest moving at all. Now what's real common when you first start to belly breathe is you'll get kind of a ratchety kind of breathing. And you can see there the book almost fell off, okay? So reposition the book and you want to breathe, and that ratchetness will actually decrease as you train and strengthen your respiratory diaphragm. So your goal is nice, steady belly breathing with your book rising up to the ceiling, your chest not moving at all. This is helping to reset that nervous system, dampen the sympathetics, and return yourself to a nice calm state of parasympathetic tone. A great way to end your day. So we just saw someone who had switched completely and was breathing in and out of their chest as their primary mode of breathing, and I can guarantee you those people have chronic levels of neck and shoulder tightness, and their sympathetic nervous system is jacked up. They're not going to do well long term. Okay. Then we saw the person that was kind of slowly learning to use their diaphragm, and it was kind of ratchety. Okay. And eventually, after you do that for a while, it smooths out. So basically, in summary, this is what I want you to do: 5 minutes of book belly breathing a night. Have a book underneath your bed. Put it on your belly. So at least 5 minutes before you go to bed every night, you are kind of hitting that reset button on the nervous system. So you're getting yourself back tuned in to that parasympathetic tone. I guarantee you'll sleep better. And also you'll wake up feeling a little bit more refreshed as well also. And it's great exercise for people who have that, oh, I can't sleep because my mind keeps going a mile a minute. So give that a try, see how you do. And if you have any questions, let me know. Thank you.